Now, as far as we know, 15,000 people have died from COVID in New York nursing homes. As far as we know. Emphasis on that part of it. The number is already much higher than the previous figure, which it turned out was being underreported by about 50%. We could probably assume that the actual number is higher still. But even pretending that the numbers at this point are accurate, 15,000 is a staggering figure. How did it get so bad? How could so many die, especially when they were already ostensibly isolated in care facilities? Shouldn't that have made them more protected instead of more vulnerable? Well, the how has been coming into sharper focus lately, and some revelations this week especially have helped to reveal the magnitude of this scandal in New York. First, the AP reports, based on records that it obtained, it says, that, quote, more than 9,000 recovering coronavirus patients in New York State were released from hospitals into nursing homes early in the pandemic under a controversial directive that was scrapped amid criticism of accelerated outbreaks. The new number of 9,056 recovering patients sent to hundreds of nursing homes is more than 40% higher than what the state health department previously released. And it raises new questions as to whether a March 25th directive from Governor Andrew Cuomo's administration helped spread sickness and death among residents, a charge the state disputes. Okay, 9,000. That's 9,000 people carrying a deadly virus, a virus known to especially infect and kill the elderly, and carrying it right into nursing homes. Keep in mind that we knew on March 25th that the elderly are most vulnerable to coronavirus. It cannot be claimed that Cuomo and his administration didn't realize what they were doing or didn't understand the implications. One of the first established facts about the coronavirus was that it hits the elderly hard and that it hits kids hardly at all. Those were the two things we knew about it right away. Those are maybe the only two facts about the coronavirus that have not changed. And yet leaders like Cuomo responded by shutting down schools and opening up the nursing homes to COVID. Why was this done? I mean, what was the reason? Or at least the stated reason? Well, the AP says this. The Cuomo administration's March 25th directive barred nursing homes from refusing people just because they had COVID-19. It was intended to free up space in hospitals swamped in the early days of the pandemic. It came under criticism from advocates for nursing home residents and their relatives who said that it had the potential to spread the virus in a state that had, at the time, had the nation's highest nursing home death toll already. Okay, free up space. So they had no choice but to send COVID patients into the nursing homes, effectively condemning thousands to death because the hospitals were swamped, overflowing at capacity, they say. Well, that's strange. It's strange when you consider this. Reading from a USA Today article published on April 23rd, 2020. It says, the naval hospital ship USNS Comfort is set to leave New York City's harbor after it floated for 3 weeks, mostly empty of patients. Projections about the spread of the coronavirus sent New York State scrambling to increase its hospital bed capacity by more than double its 53,000 limit. The federal government was called in to convert spaces like the Jacob Javits Center in Manhattan into overflow hospitals, but a month after shutdown efforts, that capacity hasn't been stretched to its limits. Comfort and its 1,000 hospital beds sailed into New York late last month, but was under scrutiny for being sparsely used. Of 4 overflow hospitals built in the state, only the Javits Center has taken of patients so far, according to state officials. Okay, that again, April 23rd, 2020. The hospital ship had been in the harbor for 3 weeks at that point. The directive to send COVID patients into nursing homes because of overflowing hospitals was signed on March 25th. So for the entire month of April, just about, patients were sent to nursing homes to free up space while an entire naval ship floated there unused, along with 4 other overflow hospitals that were also barely used. How do you make sense of this? Granted, I don't know all the logistical complications of sending patients into a hospital ship, but whatever they are, whatever extra effort or red tape had to be gone through, whatever it would be, wouldn't you make that effort rather than intentionally introducing the virus into communities of elderly people? So why weren't the ships used? We can only speculate. Here's one speculation that you can't help but wonder about. Did Cuomo choose to send the patients into nursing homes rather than onto the ships because he didn't want to have to say that Trump was helping? Was this all about making sure that Trump didn't get credit? You can't help but wonder. Did 15,000 elderly people die in order to protect Cuomo's political ego? Now, this possibility becomes even more prominent when you consider another big revelation this week. This is from the New York Post. This is what they report. Governor Andrew Cuomo's top aide privately apologized to Democratic lawmakers for withholding the state's nursing home death toll from COVID-19, telling them, quote, "We froze out of fear that the true numbers would be used against us by federal prosecutors." The stunning admission of a cover-up was made by Secretary to the Governor Melissa DeRosa during a video conference call with state Democratic leaders in which she said the Cuomo administration had rebuffed a legislative request for the tally in August because, quote, "right around the same time, President Donald Trump turns this into a giant political football," according to an audio recording of the 2-hour-plus meeting. She continues, "He starts tweeting that we killed everybody in nursing homes," DeRosa said. "He starts going after New Jersey Governor Phil Murphy, starts going after California Governor Newsom, starts going after Gretchen Whitmer." And the Post report continues, "In addition to attacking Cuomo's fellow Democratic governors," DeRosa said, "Trump directs the Department of Justice to do an investigation into us, and basically we froze." Okay, if this is true from the New York Post, and I see no reason to think that it isn't, then we have an admission of a cover-up, and one of the worst cover-ups in American history. That's not an exaggeration. This is easily, without question, one of the country's deadliest political scandals. We're talking about decisions that were made for political self-serving reasons, it would seem, that directly led to the deaths of thousands of people. More from the Post. Quote, "But instead of a mea culpa to the grieving family members of more than 13,000 dead seniors or the critics who say the health department spread COVID-19 in the care facilities with a March 25th state health department directive, DeRosa tried to make amends with the fellow Democrats for the political inconvenience it caused them. She said, 'So we do apologize. I do understand the position that you were put in. I know it's not fair. It was not our intention to put you in that political position with the Republicans.'" Yes, a political position with the Republicans. That's the concern here. Not, all the dead bodies. Not the position you put your elderly citizens in, the position of lying in a damned coffin. Well, let's not forget, while this was all going on, infected patients sent into nursing homes, thousands of people dying, a cover-up happening, Andrew Cuomo, the guy behind it all, was being awarded an Emmy for his press briefings. And he signed a book deal to brag about his COVID leadership. And he was going on CNN for cutesy interviews with his little brother. Let's all remember this.
You know what? I understand. This is the normal swab I'm holding up here now, and for everybody at home. A very valuable object. There's only one company in the entire country that makes these up in Maine. All right? Here's the swab. Is it true that this was the swab that the nurse was actually using on you, and that at first it went into your nose and disappeared, so that in scale, this was the actual swab that was being used to fit up that double-barrel shotgun that you have mounted on the front of your pretty face?
See, I said I was going to be nice and sweet.
I just want a yes, no.
And
was it
trying.
this?
I was trying.
Or was it this?
Very hard. Look.
Which was it?
Oh, isn't that so cute and sweet? Isn't that so funny? In hindsight, that's one of the most embarrassing moments for the American media ever. Well, not in hindsight. It was embarrassing at the time, too. Cuomo will continue to get this kind of treatment from the media, no matter what's revealed about it, because they're invested in the narrative that Trump and Republican governors are the ones who botched the COVID response. That's the narrative. They cannot waver from it. But the reality is clear. There's plenty of evidence that Andrew Cuomo is guilty of criminal negligence and rampant abuses of power. He should be arrested, prosecuted immediately. Maybe once they're done with this show trial in D.C., they'll get around to that. But I won't hold my breath. Well, I hope you enjoyed that clip from the Matt Walsh Show. If you did, go ahead and hit that subscribe button right down there so you can stay up to date on all of our future content.